We just finished up with the IT band and we're changing models. And our new model has been experiencing some issues with her feet. We have a plantar fasciitis problem going on, and we also, she's been experiencing some pain at the ball of her foot and in the front of her foot, which we're going to work with later. But right now, let's just work on her issues with her plantar fasciitis. As you know, by being a therapist, that plantar fasciitis is a symptom, and the problem usually originates up in the gastric area of her lower leg. So we're going to start off by getting some lotion on her, some lubricant, and we're going to be kind of heavy with the lubricant because we want these cups to stay on. So let's get her all. And as I'm applying this, I'm actually running my fingers up, feeling for any tightness alongside of the Achilles, and I'm starting to feel just a little bit of restriction as I come up, especially right here. And I'm looking and I'm going, she's got a tattoo. And tattoos are very interesting. They don't tell you when you get a tattoo that you will develop adhesions underneath the ink. And a lot of times, tattoos can be a contributing factor for many issues that your clients may be suffering from. Okay. So not only am I lubricating, but I'm also kind of getting the sense of her feet. I'm going to come in, wipe my hands off a little bit, otherwise we're going to have cups flying everywhere. There we go. All right. So the other day when I was working, I was actually using the blue cups, and I have changed to the clear handled cups. And the reason I did this, these are a little bit stronger, and I want this to have a nice suction on her heel and on her foot. So what I need to do is I take the cup, and the theory is if you get a cup that's slightly larger than the area that you're going to place it on the heel, it stays a lot better. So let's take a look at this one. And nope, this won't work. We have a big gap. So I'm going to go down one size and see that. This will work perfectly. So we're going to use the clear cup. I need to come in, draw back to maximum suction, get it on, and then mold that to the client's foot. These cups are very, very strong, so I want to make sure that it's okay with my client. Is that okay for you? Not okay. If at any time it starts to bother you, let me know. All right. Now we're going to take another cup and place it on the ball of your client's foot. There we go. Also, when you apply this, if you take your hand, for some therapists, they like to take their hand, support this as they press down. Okay. Looks good. Now, if a client is just primarily coming in to have their plantar fasciitis addressed, what I'm going to do is I'm going to come up and grab my energy cups with the negative ions so they can start working on either side of her Achilles. Remember, we're going to invert these cups, place them where you need them, and pop them down. Invert, place, check and make sure they're on securely. Okay. And what I would do is I would put these on, I would leave them for a while, usually about 10 minutes, and then come back and pop these off, leave these on, and I'm going to follow the Achilles up to the attachment point into the gastroc, and we're going to work that. So let's say these have been on for 10 minutes. You're going to come in, and you can leave the lower ones on loosen these up, move everything out of your way. And I have kind of rigged a contraption. My favorite cup in the the polycarbonate set is the curved cup, but sometimes I like to use it without the tubing. So I took all the guts out and I attached the bulb from my 45 cup, and this gives me great access to this curved cup without having to worry about the tubing. So I'm attaching that cup on that gastric area, and the reason I'm using the curve, you can see her leg wouldn't allow for a cup to stay on successfully. And you can see that I am just doing a little cross fiber in here. I would have, before that, I should come in and actually do my suction and release. Then I would do my cross fiber. Are you okay? All right. Slowly start coming up. Loosen that up just a little bit. And you can see we're not even working on the plantar portion yet, because most of the problems start in the lower leg, around the Achilles, and the gastroc. There we go. All right. It feels nice and loose for me. And I'm going to go in and I'm going to take, I think, another one of these energy cups, find the point, the insertion, put that cup back on. Now I'm going to come in and take these energy cups off, and I'm going to switch cups, and I'm going to use my oval cup. The oval cup is nice and strong. It's oval, and it allows me to get into areas that I would not be able to get into with the other size cups. So I'm going to come in on either side of the Achilles, and I'm going to just start suctioning and releasing here, and that should be nice and loosened, and it is. I love pre-treating areas. It provides more comfort for the client than just going in and attacking an area. As I'm doing the inside the medial aspect, she's really tight. Now I know that cups tend to draw fluid, and I've had a little swelling here, so I'm trying to figure out if it's swelling from the cupping or, and I want to move some of that fluid up and out of the way. So I'm changing the direction of my cup. Whereas it was going vertically with my cup, I've changed it to horizontal so I can grab fluid and drag it upward. Okay, looks good. Going to leave that cup on. And now I'm going to come down to the heel. And I want you to notice when I take this cup what her heel is going to look like. And that was on really good. Ooh. Nice and purple, pulling up a lot of stagnation. But you notice I just work on it, and look how fast she cleared up. She's in great shape. She's got an active lymphatic system. It seems to be working really well. Pop that one off. And it was actually purple as well. Okay, so as you know, plantar fasciitis, there's a little stirrup here, right on the side of the heel. So people that have active plantar fasciitis, if you touch that and you press in on it, they tend to just jump right off the table. And I always talk to them when they come and tell me that they have heel pain. And I'll ask them, do you have heel pain all the time? Do you experience it mostly when you get up in the morning? And they go, yeah, I get up out of bed, I can barely walk. About 5 minutes later, I'm able to walk okay, but it bothers me out throughout the day, especially if I've been sitting. And usually that's a pure indication of plantar fasciitis. Okay, and I'm really getting in there and working in that area with my finger. And now I'm going to come in and I am going to use my oval cup once again and start working on the bottom of her foot, loosening up, freeing these tendons. Oh, we got something going right here. So we're just going to hang out. Shake it a little bit. Come in. Does that hurt? No. Okay, good. So when they have plantars, if you can come in, and I am going to switch cups. So I've gotten up and I picked up my gun again because every foot is completely different. And the smaller cup usually gives you a lot of suction, but I'm going to see. I don't know if this is going to work, but let's try it. And so it's falling off. The foot's curved. So I'm going to go back and use my curved cup on the bulb here, and let's see how this is. Oh, look how that is great. It's not coming off, and I'm able, I think, to move this. Yeah, and this is what I want. I want to start giving space in her foot and work on any type of adhesions that may be forming. Like I said, feet are very difficult to work on. They have a lot of curves. Some people have flat feet. So you have to be very patient when you work and know that, just trial and error. If one thing doesn't work, pick up another tool. There we go. Oh, nice. So remember I told you that she was having some pain between her toes? We're going to address that as well. And it all may be a contributing factor with her plantar fasciitis. She may be shifting her weight differently on her foot. And I see a callus over here that's causing some pressure on her plantars. So remember we did a little bit of the twisting here, kind of breaking that up. Come in with your fingers once again, get in, and I keep running down. I'm trying to create space between her toes, coming down, grabbing that stirrup again where the plantar comes in, loosening up here. And now I'm going to come up to her heel, and I'm working around her heel, and a lot of times you're going to feel a hard crystal right in the center of her heel, and that may be one of the issues as well. So we've got a nice flat spot. I'm going to switch and I'm going to use my gun again. Oh, nice. Now this is really gripping. You can see how nicely that grips. So what I'm doing is I am lifting the outer layer off any type of adhesion there, maybe a bone spur, maybe that's causing an issue. So with the foot there can be multiple factors creating plantar fasciitis. A lot of times it can be posture, how they walk, sitting, not sitting, hereditary. Coming in here, giving her a little more space between her toes, between the metatarsals, coming up, working in here. And then I would finish by applying some of my herbal cream to the foot. And that should do it.